Good afternoon, viewers. We are live from Sakra World Hospital again, and we have with us our expert, Dr. Shivakumar Sambargi. He is a consultant in the Department of Pediatrics here. Welcome to the show, sir.
Thank you.
So today we are here to talk about the importance of vaccination and why is it so relevant for us to know about vaccination at this point of time. So, sir.
Yeah. See, I think vaccinations have been going on from last 30 years of our medical history, what we are doing in the last 30 years. And most of these vaccinations are for the protection of the infections for our pediatric age group and also for the adult. We give vaccinations. So these protect us without the side effects of the infection. So that is what is the main theme why vaccinations came into picture and why we started giving it to our pediatric age group and the general public. So now I think we have vaccinations being spoken everywhere. We have vaccinations about COVID and so many things. So that's what I think is a hot topic which is going on now.
Right. So like rightly pointed out, the talk of the town is about COVID and its vaccination. We are so lucky that then it has rolled out now. So my first question is, it's around again COVID-19 and its vaccination. Is it mandatory for individuals to get vaccinated against COVID-19?
In India, I don't think the government has made COVID vaccination mandatory. It is voluntary. But what is important for us is when you take the COVID vaccination, we are protected against the severe infection of COVID, and which in turn protects our co-workers from spreading the infection, our family members. So this in a long term helps in flattening the epidemic curve or even abruptly stopping the epidemic curve. So taking vaccination is important, but yeah, in India, it is a voluntary job for us.
So voluntary. So it's not a compulsion yet.
Yeah.
How effective is the COVID-19 vaccination? Since it's been rolled out, I think about a million people have been vaccinated so far. How are the results? How do they look?
See, in India, I think we have two vaccines now which are in the market. One is Covishield and Covaxin. And both these vaccines, effectivity rate may be somewhere above 60%. If you take other vaccines from the other part of the world, and maybe in a few weeks, we would also get other 2-3 vaccines also probably approved from the Drug Control Board of India. The efficacy of the vaccines may be somewhere around 60 to 90, 94 to 97%. So that is the protective rate of the vaccines. So you don't get, so sometimes in some of the COVID vaccines, even up to 94 to 97%, you have a protection rate.
Right. So it's pretty effective to say.
Yeah.
Now the next question is how safe it is. So people who already have more comorbidities or have predisposing conditions, for them especially.
Okay. I think this is a very, very genuine question. Anybody who would take vaccine would want to know, is it safe? Does it cause some problems? This would be minded of everybody. But when you take a COVID vaccine, they are pretty safe, and the Drug Control of India should have probably taken safety measures as the first one before approving. When you come to a large share of a COVID vaccine, there are some minor side effects. There are some major side effects. So if you take the minor side effects are somewhere pain at the injection site, redness, some fever, chills, body ache, and also probably these are some of the minor side effects which may be in around 30 to 33% of people. The cause of this is some immunological reaction to the vaccine, COVID vaccine. It does not mean that people who have these minor reactions are only protected. It's just how the body reacts immunologically to these COVID vaccines. Okay, so these minor side effects are around 33%. Then we have some major side effects, and most of these major side effects are because of the allergy to some genetic component or some component of the vaccine, which can be allergy, anaphylaxis, and so on. So what the government has done is probably they are more worried about these major side effects. So that is why all these vaccinations are done in a center where you observe for half an hour to see if there are any side effects there or no. Okay, so that's what is about the minor and the major side effects. Now when we come to a vaccine per se, all the vaccines which we have been giving for the last 30 years have minor side effects, also have major side effects. So there is nothing different for a COVID vaccine now. So it is pretty safe. As the last 30 years we are taking vaccine, we should continue to take the same vaccines, the same way, even the COVID vaccine, without making any differentiation, whether it is more harmful or anything. It is pretty safe vaccine.
Right. You also pointed out that there may be a few side effects around it, and that is one of the reasons that once you are subjected to that vaccine, you are asked to stay at the center for about half an hour, 45 minutes.
Yeah.
Right. So now, next question is, what should be the time duration considered that yes, it's an expected side effect and not something majorly has gone wrong. So to what extent these side effects can last?
See, the minor side effects can be there for a day or two, and they are manageable side effects. You don't have to take any medications or anything. Major side effects probably are monitored in the first 1 hour, half an hour to 1 hour. So if any of these allergic reactions or anything happen, it will be tackled in the hospital. If not, I would say the commonest side effects, which are the minor side effects, would be there for a day or two maximum, not more than that.
Right. Coming to your area of interest, that's pediatrics. Where do you foresee that this vaccination would be rolled out for children?
Okay. See, the vaccines which have been approved now, they have been approved for all the age group above 12 years. So less than 12 years is not still approved. I think they have started a trial for children's. Once we get the data, which probably they are saying in the month of December, November or December, we would also know how safe is the vaccine for the pediatric age group. For now, I think it is only about 12 years of age.
All right. Now, this is a question from an individual who has already undergone the vaccination. So the question from him is, how does he know that it's working for him? Is there any particular physiological symptoms that he or she probably experiences so that he understands, okay, probably my body is accepting it or probably rejecting it? How does it work?
Okay, so basically to be 100% confirmed is to do antibody levels. Okay, that is to see really antibody levels are there or no. And what they talk is after taking the second dose of COVID vaccine, after a week or 2 weeks is when the protective antibody levels are developed in the body. So that's why all the people who initially spoke that probably when you take 2 doses of COVID vaccine, you still have to continue social distancing and wearing mask because the antibody levels to be protective develop mostly after 2 weeks. So first thing, when you take 2 vaccines, what is important for you is next 2 weeks you still have to continue to have the same lifestyle of maintaining social distancing and other things. Other than that, probably you may not get a severe COVID infection. That is what we can say when you take the vaccine. So whatever data we have got from all the studies being done from Covaxin and Covishield, they have found out even if you chance of getting exposed to a COVID, you should have a minor cold cough but not serious infection. That's why I think the government of India also has rolled out vaccine in such a urgency and emergency. Never in the history of humanity has vaccines been rolled out so early. Within a year of pandemic, we have vaccines been given to all the general public. So it is pretty safe, and that's the only way to go ahead, I think now. COVID vaccines and herd immunity is the only way to go ahead for further.
Right. The question is, how does this vaccine, so somebody who's been subjected to the vaccine, does it affect that individual's everyday activities, the way they function, the way they move around?
No, I don't think so. In fact, when we all took vaccines, we just took it, we waited for half an hour after taking our vaccinations and continued to do our hospital work as usual. It is in no way going to disturb your everyday activities. You can continue to go to offices, you may continue to do your all normal activities. It does not affect your everyday activities in any way.
It doesn't. So we can absolutely rule out
that.
Yeah. Right. For elderly peoples, it's recommended, and to what extent it can be said that it's also safe?
Okay. See, I think in all this pandemic, the most hit people were the elderly people with the comorbidities. That is why I think the government, after the frontline workers, they started speaking about giving vaccinations to the elderly people more than 60. And these are the people who should be first protected. So we know most of these elderly people also have a lot of comorbidities. They are on a lot of medications, but they are a priority to start to be vaccinated first. So that's why it has started, and it is pretty safe even in all the elderly people. In fact, if you had seen some of the newspaper in Bangalore, a 97-year-old went and took a COVID vaccine and is all safe. So many of them elderlies have been taking. I think it's our priority to get all our elderly population to get vaccinated as early as possible so that we start flattening this pandemic, whatever the first wave or the second wave what we're talking about.
Right. We are coming towards the end of this session, but before we say goodbye to you all, I have one last question for you. So how do you foresee this, that the life is going to be normal again, like back in 2018 or probably the early part of 2019? How do you see it? How soon can we get back to our regular, where probably the schools are open again? Because I think offices are kind of getting open now with say about 25-30% of occupancy. But when do you see actual the schools getting open? Because that's when probably we can say that yes, we are actually back to normal.
So I think this is a really difficult one to say. Probably the whole thing is to develop herd immunity. As early as possible, we start developing the herd immunity, we'll be able to probably come to the end of this pandemic, but nobody has an exact answer. So what they are trying to do is probably to increase the herd immunity. One is to get natural infection, which has been having with this first wave. The second one is to give vaccination. To cover all the general public as much as possible with the vaccination, so they are partly or even protected from this COVID, is the only way out. And I think there is no other way for the government all over the world to do other than this. They have to have social distancing, wear masks, continue to vaccinate the people, and see how things go around. Other than that, I think it's only having social distancing and wearing masks till we know how things turn around.
Well, thank you for that insight, sir. And with this, we have come to the end of today's live session. If you have any question, you can drop those in the comment section. Our experts will answer to those. And thank you again, sir, for joining us. Thank you all.
Thank you. Thank you.